Yeah, I work on the observation unit, also known as short stay clinical decision. And these units result in shorter length of stay and can decrease healthcare costs because the patients aren't admitted to the hospital. On my unit, the window is 48 hours to carry out triaging, diagnosing, treating, and monitoring the patient's response anytime before the 48-hour mark. So the decision is made to keep the patient or discharge the patient. The most common task that we have to do on the unit is the oxygen walking test to see if the patient needs oxygen before going home. We have to do these a lot coming on the unit with the patient that come in with acute respiratory issues. But the most common diagnosis that I see on the unit is chest pain. It could be cardiac related, or it could be musculoskeletal related, or it could be respiratory related. But we also keep the patient NPO regardless, just in case we need to perform any tests or procedures. So once that doctors say that we can feed the patient, we put in a diet order. Yeah, we have a bunch of food for them to eat. So we keep that nourishment room stocked. But the most common diagnoses I see are cholecystitis, appendicitis, like I say, respiratory issues, and sometimes TIAs or congestive heart failure, just to name a few. And this little doll here we have for our demented patients, just something to keep them entertained. No, he needs to stop. Don't do that. Yeah. Yeah, he don't need to do that. They outside of work. They out. It's so many other options. Yeah. This notice is given to all the patients on the observation unit, basically stating you're outpatient receiving outpatient services, which can be very costly to their insurance. They do get very upset about this, but being that it's supposed to help lower healthcare costs, it's a win-win. Hello, my patient in room 104. Can she have a late breakfast tray with pancakes and a boiled egg? She was NPO, but now she's able to eat. My callback extension is 2847, and my name is Megan. That's room 104. Thank you. So today was a good day. There was 3 nurses, 1 team lead. All 3 of the nurses had, well, 2 of the nurses had 4 patients. 1 nurse had 5 patients. And 1 of the nurses got sent home. She got sent home around 2 o'clock. The census was low. Once it get to a certain percentage, that's when they start to send people home. And we had 2 tests, patient care tests. One of those got sent home shortly after that nurse got sent home. So right now it's just 2 nurses and a team lead. And we each have 4 patients. We got 2 coming in. for both of us, between both of us. They got one that's getting discharged, and then the other two. So it's a chill shift right now, and it don't be like this often, hardly ever. So I'm not sure if somebody else gonna get sent home, but I doubt it, because since we got 2 new people coming in. But that's how it be on observation. And so my 4 patients, one of them have inpatient orders, meaning he needs to get transferred to another unit, so waiting for a bed to become available. So that can become available at any time, and I hate when it become available toward shift change, because then the receiving nurse does not like to take report. They like to put you on hold, and then it goes into the night shift. The night shift definitely not gonna take report till like 7:30, so I'm not getting out of here till like 7:45, 8 o'clock, and that's not cool at all. So yeah, hopefully that does not happen, because then I got, like I said, my admission coming. So, but so far so good. Hey, this is Megan in observation. Can I get a PRN breathing treatment for my patient in room 115, please? Thank you. Scan your wristband. Well, so this cocktail includes dexamethasone, which is a steroid, so it's an anti-inflammatory. Metoclopramide, also called Reglan, is to help with nausea, vomiting, motility of the stomach. And lorazepam, also called Ativan, is for restlessness, anxiety, so supposed to help calm you down. But the dexamethasone, it can cause upset stomach and sleepiness. Anything you need to mention? You want to go ahead and proceed on?
Oh yeah, I'm not actually a doctor, I'm not a doctor.
Okay.
Through drought and famine, natural disasters, my baby has been around for me. Kingdoms are falling, angels be calling. None of that could ever make me leave. Yeah. Every time I look into your eyes, I see it. You're all I need.
we as nurses and patient care techs, we draw our own labs. Sometimes the phlebotomy come down if we have a difficult step, but for the most part, we do it on our own. And these are tablets for the patients. They're able to view their chart. They're able to communicate with us. Like they want a cup of water, they can send us a message and it'll come through our electronic charting system. Then we got the Medtronic interrogation system here. When the patient has a pacemaker, we can interrogate it at the bedside. It's pretty quick and easy. Here in observation, we're always passing medications. There's not like a certain block of time where we pass medications because we can get a new patient and they come in and their medications need to be started. And it could be like 3 o'clock in the day, but also we got patients that we started out with that may get started on new medications. So it's a constant medication pass, and amongst other tasks that we do, phlebotomy, cardiac monitoring, prepping for surgery. We do a lot of tasks here on observation, and you got to be very independent. But there's a lot of teamwork here on the unit. I can say from speak for myself, and we make sure we all take a break. So on this break, I'm eating my noodles. You have to try these noodles. I got them from Publix. They're so good.